As Americans do begin to step back outside, scientists are racing toward the vaccine that public health officials have said will mark the moment when we are truly safe to get back to our pre-coronavirus lives. Dr. Paul Offit is the co-inventor of the rotavirus vaccine that saved thousands of lives. He currently is the director of the Vaccine Education Center at the Children's Hospital of Philadelphia. Dr. Offit, good morning. It's great to have you with us. I want to get to the vaccine in a moment. But first, as someone who has studied public health for most of his life, what do you think when you see those images of packed New York City parks and the idea of malls across the South crowded with people tomorrow morning?
You know, while it's certainly true that we need to get back to work, it's a shame that we don't have the kind of testing that would inform us how to get back to work in the safest way possible. And I think at this point, we're not going to get the kind of testing we need. So we're in the midst of doing a grand national experiment where I'm sure we're going to find 3 or 4 weeks from now that there were certain sections of this country or states in this country that went back to work that shouldn't have gone back to work. And unfortunately, I think we're going to have to learn that lesson the hard way.
And as I said, you helped to develop the rotavirus vaccine that saved thousands and thousands of lives. Now we're hearing about Operation Warp Speed, which is the White House and that task force, including Dr. Fauci and doctors across the country, working faster perhaps than they've ever worked toward a vaccine. They're hoping by January, by some reports. In your experience, how extraordinarily quick would that be?
It's unprecedentedly quick. I mean, typically, vaccine programs take about 20 years from research to a commercial product. This is being done in 12 to 18 months. So by definition, there are steps that are going to be skipped or coalesced. I think the big one is that typically you have, before a vaccine is licensed by the FDA, and I think this won't be a licensed product. It'll be an FDA-approved product under the emergency use authorization. I mean, typically you have a large prospective placebo-controlled trial that involves tens of thousands of people. I think that's not going to happen. So we'll probably test it in a few thousand people before it's then rolled out to the public, which means there'll be some level of uncertainty. But I do think that in the midst of this virus, which is, killing 1,000 to 2,000 people every day, I think we're willing to accept some level of uncertainty to try and stop this scourge.
So is it possible then, Dr. Offit, that in our understandable rush to a vaccine, we may make a vaccine that's less effective against coronavirus?
I think we can make a vaccine that's effective. I think we probably won't know exactly how effective until it rolls out there and we look at much larger numbers of people. I think we also can be confident, I think, before the vaccine rolls out that it doesn't cause a common side effect. I think it may not be till after it's out there that we find out that it may cause a very uncommon side effect. But again, it's a level of uncertainty I just think we're going to have to live with, given how much we need a vaccine and need it now.
I'm sure we'll be talking to you much more as we race toward that vaccine. Dr. Paul Offit, thanks so much for your time this morning. We really appreciate it.